Now here we're going to talk about systemic mastocytosis. Systemic mastocytosis is mutation in KIT and tyrosine kinase, or in the genes that codifies for these kinases. This is a mutation in the cells of mast cells of the bone marrow and skin. There is infiltration into the skin. The bone marrow also could go to the liver and spleen. The symptoms would be of massive release of histamine that would lead to pruritus, urticaria. Durier's sign. Durier's sign is urticaria at point where the patient is touched. Sometimes syncope and hypotension, nausea, vomiting, diarrhea, abdominal pain. Some of the triggers include NSAIDs, narcotics, aspirin, and the treatment is to reduce the secretion of histamine, so we will give antihistamines. We can give steroids. Cladribine inhibits the DNA polymerase of the mast cells, would lead to breakdown of the DNA, and adenosine deaminase would be inhibited, so adenosine will be accumulated on the cells and will kill the cell. Sometimes, because there is increase in the histamine is a molecule, a hormone for the parietal cells of the gastric fundus and body, so there would be increased release in chloride acid, and this would lead to peptic ulcer disease. So a patient would present usually as peptic ulcer disease that is not responding to treatment with syncope, flushing, etc. The most accurate test would be biopsy of the bone marrow and skin, and the best initial test will reveal increased levels of tryptase. Tryptase is also produced by the mastocysts or the neoplastic cells that are mastocytes.